Chair Greenland and members of the committee, first I want to say thank you for giving us a chance to come and speak today.
First you need to introduce.
All right, I'm Kate in Wheelock, and I've been working with people to promote health with people who use drugs for over 15 years. I'm also a fellow at University working on an MPH in overdose and addiction. As you all are well aware, our nation and our state are in the middle of an addiction crisis. Addiction has lowered life expectancy 3 years in a row nationally and is costing roughly 500 lives here in Oregon every year. This body has worked for many years to save lives by expanding access to naloxone and by making it easier for people to call 911 in the event of an overdose. We're here today to talk about another harm reduction strategy that our state should consider to ease this crisis. Overdose prevention sites, also known as safe injection facilities or safe drug consumption spaces, are places where people can bring drugs that they purchase in the community and use them in the presence of trained staff who are able to intervene in the event of an overdose. These spaces, which typically serve people who are living outside and at high risk for overdose, allows them to use in a safer way by bringing them out of public restrooms and doorways and into a space that has safe tools to prevent the spread of HIV and hepatitis C, as well as leading them to other connections within the community for healthcare and drug treatment services. These spaces have been shown to lower overdose death rates, HIV and hepatitis C infections, skin and soft tissue infections. They've also been shown to increase the likelihood that people will access drug and alcohol treatment and do not negatively impact the greater communities where they're located. Each day I have clients who are using drugs in really unsafe ways coming in, and they're doing this because they are given two options. One, they use publicly where people can see them, which is not something people want to do. And so then they risk the scrutiny and shame of being seen while using. Or they hide in places where if they were to have an overdose, they are less likely to be found and there's less likely to be intervention. Just yesterday, I assisted in reversing an overdose on a freeway on-ramp right outside my office. And this person was choosing to use there so that she wouldn't be viewed by people who are passing by and driving by. However, when this overdose event happened, it was much harder for us to access her, and had she not been with someone, she would have been over there alone and no one would have known she was there. Obviously, this is not ideal conditions for drugs. Currently, there are over 120 overdose prevention sites in 10 countries around the world. Cities including Seattle, San Francisco, New York, Philadelphia, and most recently Denver have all shown support for opening overdose prevention sites. And 10 states across the nation have introduced legislation around this topic. In addition to the health benefits associated with overdose prevention sites, a study out of San Francisco showed that one site could save an estimated $3.5 million in healthcare costs annually by preventing HIV and hepatitis C transmission, hospitalizations for skin and soft tissue infections, and loss of life from overdose. So far, Oregon has been fortunate that we have not seen the increase in fentanyl in our drug markets as many parts of the country have seen. However, we know that that's changing. We've seen an increase in fentanyl-related deaths in the last year, with 2017 numbers not yet released. And we have an opportunity to act now and early to prevent what's happening back east from happening in our communities here. I'm very hopeful with all the work that the state has been doing to expand access to treatment. It's important and we need to do it, but it takes time to build those systems, and people are dying today. Overdose prevention sites are an important harm reduction tool that we should be using. They save lives, and they should be an important part of our continuum of care for people who are using drugs. So thank you for your time, and I'm going to pass it off to Dan.